Oh, wow. I didn't
Yeah.
know Zoom does it for you. I thought you had to use a third-party software.
Oh no. Do you what do you normally do it on?
Well, this is going to be my first podcast ever. So I've been like,
Oh, fun.
yeah, I was like, maybe we could experiment with different software, but I was like, I don't know, we're both pretty used to Zoom. So
Right, right. Oh,
yeah.
that's great. Yeah, so this
Yeah.
is the first podcast.
Yeah. I don't know if he told you, but I'm starting a YouTube channel. I already have a TikTok channel about health. So then this make it easier just to make several shorts for all the other social media platforms.
Oh, fun. That sounds so
Yeah.
great.
Yeah.
Well, lovely to meet you.
Lovely to meet you too.
And
How's
you're,
the how's the weather in Boulder, Colorado?
oh, it's gorgeous right now. It's glorious. I love this time of year. How about where are you?
Nebraska.
Oh, how's the weather there?
It's really good. I got outside today. It's nice. Yeah.
Nice.
Do
So
you?
nice spring weather.
Oh yeah, we're experimenting with some gardening this year.
Oh,
So
good. I am too.
yeah.
I've getting some herbs and jalapenos this time.
Oh nice.
Yeah.
Yeah, I'm growing the same thing. What kind of herbs are you growing?
There's a variety out there. I used to grow a bunch and then I got divorced and gave up on that.
Yeah,
So I was like, oh, I don't have time for that anymore.
a lot of
Um,
work.
yeah, yeah. Are you growing a bunch of stuff or
Yeah, it's first year of gardening, so I'm like just growing a little bit of everything. I got okra out there, I got Brussels sprouts,
oh,
tomatoes,
fun?
lettuce, and just like something will survive.
Yeah, that's great. And so
Figure out.
your social media focus is health related and is it
Yep,
wellness or any particular area?
gut health.
Gut
Because
health. Oh, awesome.
yeah, I started it because I couldn't figure out IBS symptoms, what I was going through. So I was just experimenting with a lot of different diets and stuff and like kind of documenting the journey and like having other people seeing my videos motivated me to stay on track. And
Oh,
yeah, I
that's
mean,
cool.
pretty much the IBS symptoms are gone. I've
Good for
had it for a
you.
couple of years. Yeah.
Uh-huh.
Yeah.
Oh, good for you. That's great.
Thanks. So now
So,
I can
and your
start.
camera's not on. We're already recording.
Beautiful. I just
Yeah.
want to make sure that everything got record or got set up properly, but looks like we're good to go.
Cool.
Yeah.
Well, I'm happy you guys are connecting. Have fun. And Terry, I'll talk to you. I'll talk to you after.
Okay. Sounds
And then
good.
Liberty, we'll download and send over to you once at the end as well.
Okay, cool.
And in
Awesome.
fact, do you want me to like stop this one and then I'll start it and we can like
No,
go?
it's easy to
Is that?
cut. Yeah.
Okay.
All right. See you guys.
Bye, Aaron.
Okay, awesome. But yeah, I mean, since I live so close by to you, I should come visit your office sometime. I mean, not close, right? But it's like a little vacation there.
Yes, you could do a vacation, come visit the office.
Yeah,
Yeah.
pretty cool.
So do you want to get started?
Yeah, sure. Um, so can you tell me a little bit about your background in this? Like what made you even really want to help people with mold toxicity or have an interest in it?
Yeah, like most of us that do mold toxicity, I've had a few large exposures that have wrecked my life in the past. And that's, how I ended up learning about it. And then, it's my practice is probably 80% mold now. And so, my whole sort of career in life is dedicated to mold and bringing mold treatment and awareness out into the world. Yeah. Do you want me
Uh,
to tell more of my
oh
story?
yeah, yeah, go ahead.
Sure. So, well, I'm a MD. I went to University of California, San Francisco and did a family medicine internship. And then I got board certified in integrative holistic medicine. I could go on and on with that stuff, but I won't bore you. And when my son was 8 years old, he started limping. And he was one of those just really crazy, thrill-seeking maniac, like fearless little boys that was too busy to eat and was climbing up things and jumping off and trying to kill himself all day. And suddenly he was just limping. And like I would look at him and he would walk down the stairs sideways, holding onto the rail. And I would be like, Kai, honey, do your knees hurt? And he'd go, no. And then he'd turn around and go forward and do it straight, like if he wasn't if he didn't know I was looking, he was like limping. And then he started getting stiff, like after a car ride, and he got kind of crazy anxiety out of nowhere. And then he put on like all this weight on his like teeny little boy frame, um, which is a kind of a common mold symptom. Um, and then, so I tested him for a bunch of stuff, and I was treating a lot of Lyme disease at the time, and I sort of didn't want it to be Lyme. So it wasn't in the first couple batches of testing I did because I just really didn't want it to be that. But it ended up being Lyme. And then we ended up figuring out that we had quite like a huge amount of mold in our house. So this was 2014, and in 2013 was the Boulder floods. And our entire block was full of kids. It was one of those fun, like dreamy blocks where like all the kids just go outside and play all day. And every other house on our block got destroyed by the flood. And we somehow thought like we were okay. And it turned out there was 3 feet of water under the entire house. In the crawl space, like underneath the vapor barrier. And so like the crawl space went under the whole house. Um, and the airborne spore traps were in the red for like 4 different classifications of mold. And you really just don't ever see that because negative air traps are usually negative. I mean, sorry, air traps are usually negative, even if there is a big issue. So it was pretty bad. And so at that stage, so there's a relationship between mold and Lyme, and basically so mold is a complete attack on the immune system. And in the presence of mold, Lyme can become opportunistic and replicate and reactivate and kind of wreak havoc in the system. So the why Lyme had sort of become active was the mold in the house. And so then, we started him on phase 1 mold treatment with binders. He got a little better, not really. And then we had to remediate the house in order to sell it. And I didn't want to stay in it. I just didn't trust my kid would ever get better in that house. And so we remediated, which was a massive nightmare job. And my marriage didn't really make it out. But when we moved out, and we got Kai out of the exposure and started him on phase 2 mold detox with antifungals, he got better. Oh, I didn't tell you so he started limping. I figured out it was Lyme. There was a water leak in the attic above his room that I had fixed by somebody that didn't know about mold. And I didn't know yet about mold. I didn't know anything. And so, if you remove wet moldy material without containment or negative air pressure, you sort of just spread it everywhere. So as soon as you like pull like a wet moldy piece of drywall out, the mold spores get angry when they get disturbed and they release more mycotoxins, the toxins that make you sick. And so they pulled that moldy material through my son's room and then through the whole house. And so after that happened, Kai didn't get out of bed for 6 months.
Oh,
He was
wow.
in he was in 9 out of 10 pain in his head. It got worse with any movement at all. He could barely do anything. I called it a migraine. It wasn't responsive to migraine meds. And I took him to every specialist you could ever imagine, every healer you could ever imagine, multiple Lyme docs. And then I flew him out to California to see Dr. Stephen Harris, and he gave us a mold test, and I tested Kai, and that's kind of how we found out because his levels were really high. And so then I'll fast forward again to when we did move out. And when we did, and he started on antifungals, he recovered. His head pain went away. And then, within 3 months, he was back at school full time and playing soccer 6 days a week again.
Wow. Well, that's
Yeah.
like impressive recovery from just being bedridden to then now he's back in school and completely
Yeah.
back
I
to
mean, kids
normal.
recover easier, I think, than adults do.
Yeah, it takes longer for sure. They
Yeah.
just bounce back. But when they pulled those sheets out and they're dragging it through the house, What made you, did you have any inkling, like maybe he's having mold toxicity, like
Oh,
that?
so I had them fix the water leak when we were out of town.
Oh,
I didn't know any better. I knew nothing about, it was 2013. I knew nothing about remediation. So I didn't
yeah.
like, watch it happen. But now I know, that's what happens if you like disturb the mold and you try to pull it out without any containment or negative air pressure. So we actually always tell people like, just don't, like if you're mold sick, don't touch it until you can get a good remediation company there to create containment, because you'll just make it worse.
Oh yeah. I mean, so many times, in my life where I was just like, oh, I'll just pour bleach on it. And that's like the worst thing you could do, you know?
I know who would think that, yeah, bleach does not kill mold. It bleaches it for a
No.
minute, makes it look white.
If anything, it makes it a lot worse. I was listening to Barbara O'Neill. She said it makes it even more toxic. So
Yeah,
it was like,
it makes it
whoa.
angry.
Yeah, pretty much.
Yeah.
So you went from that to, so like, was there an inkling, like maybe it's mold or something because of the natural disaster that made you go and get the mold test finally?
Yeah, so I mean, it was all sort of mixed up around the same time. So I'd been smelling something musty and weird in Kai's room for a while, that I was suspicious of mold. And then I had that company come out and then he got way sicker. It didn't occur to me yet that that's what had happened. Like when he first, just was a 9 out of 10 pain and couldn't get out of bed until I flew him out to see Dr. Stephen Harris in California. And he gave us a real-time labs urinary mycotoxin test. And so we did that. And then that was really high. And then I was like, okay, so then I got like a good indoor environmental professional out to the house to do a full evaluation, and they found the mold. But no, I wasn't thinking mold before that. I didn't know about mold really yet.
No, and I'm
Most
just
of us
like,
didn't.
before they even sell homes, I don't even think they're really testing enough for you to even like, because people could be moving into that home, and then they're having the same problem or something, you know?
Yeah, so you have to disclaim it
Do
when you
you?
sell the
Okay.
house. So we had to disclaim, but we also said that we remediated, and we did. We spent a fortune to remediate it and sell it.
That's good. And maybe it's by state too, because I know like stories where it's easy to like hide certain things,
Oh,
and then
it's
people move
true.
in.
And
Yeah.
I highly recommend getting an ERMI or a dust test before buying a house
Yeah.
if you're mold sensitive.
Oh yeah. Which I
Yeah.
think pretty much everyone is. It's just some are more than others, right?
Yeah,
So
maybe.
yeah. We went over like what inspired you during this time. Were you a holistic doctor at that time, or were you just like general practicing or
Yeah, so I was doing holistic integrative medicine. And then I was trained in functional medicine. And like 20 years ago when I was doing functional medicine, my practice population's a lot different now, but at that time, about 80% of the patients that I saw, got better with regular functional medicine intervention. So, get them sleeping and work on their adrenals and clean up their gut like you had to do, and, all of that. And they get better. And about 20% of my population just wouldn't respond or budge to anything. And
wow?
most of them all turned out to have biotoxin illness, so either Lyme or mold. And so by the time it happened with us, I was treating quite a bit of Lyme disease in clinic, from like, the functional medicine approach.
And do you think like the Lyme started because maybe they were in an environment that just wasn't like conducive for them? Like maybe they were in a moldy environment and then that weakened their immunity to get Lyme? Because some people they'll get, a tick bite or something and they don't respond to it, their body can just fight it off.
Exactly. Yeah. So the way I look at Lyme disease is, if I'm gonna, these are made up numbers, but I would guess that if you did a really good Lyme test on a random sampling of the population in the Northeast, my guess is 90% of people would have exposure. I mean, I'm from Virginia. Everybody had Lyme at some point or another, and there's ticks everywhere. And So less than 10% of those people with exposure to Lyme actually get chronic Lyme and get chronic symptoms. So I look at the why. So why did it take your body down? And there's a good 5 treatable reasons that we know now why Lyme will remain chronic in the system. And mold is like number one. It like just totally shifts the balance because it completely attacks the immune system, and then Lyme reactivates and becomes opportunistic in the presence of mold.
Yep.
Yeah, so like yeast overgrowth can do that, parasites can do that, gut dysfunction because your immune system lives in your gut. Um, but yeah, so at the time where those patients, I mean, back then I didn't know about mold yet, so probably a lot of them had mold. And I was treating them for Lyme. But then as soon as I knew about mold, I don't treat anyone for Lyme without testing them for mold first.
Do you test them for parasites as well?
I do. You don't always catch them though. We don't have great stool studies for parasites. So like if you have a chronic Lyme patient and you've done everything like to gut cleanup that you can find in a stool study and treated any mold in the system, chelated heavy metals, detox environmental toxins. And like if I go through all the different things and they're still symptomatic, I'll do then like a parasite cleanse, just a presumptive one. Because it's one of those things that it'll just, if it's there, it'll allow Lyme to just continue to go crazy in the body.
Yeah, for
Yeah.
sure. Well, that's good that you have like a parasite protocol too. So,
Yeah.
um,
Do you have any experience with mold? Kind of sounds like maybe you've,
I just love studying health stuff, but yeah, I mean, I grew up in Portland, Oregon. So the
oh,
interesting thing was that, there's mold everywhere. It's raining all the time, right? So then when we moved to Omaha, Nebraska, my asthma just went away.
wow, that's cool.
Yeah. So they thought I was gonna have asthma for all my life because it was really bad in Oregon.
Uh-huh.
Yeah. So never had to have an inhaler since.
Oh my gosh, that's amazing, huh?
Yeah.
Do you think the place you were living in was particularly moldy?
Oh yeah, we were in like apartment complex, and like I said, it's raining all the time in Oregon. Like, and just the way our normal homes or apartments are structured, it's just like it's destined to happen. They're not built for not having a moldy environment,
You're
and people
speaking
don't.
my language. I always joke like we make our homes in this country out of mold food, and then we put like pipes of water going through the mold food, and we go, hope
Yeah,
for the best.
yeah.
So
And
mold loves cellulose. It eats cellulose, and that's what our drywall and our wood and our paper, and all the building materials we use in the US.
oh yeah. My husband's a contractor. We're both really into
Oh,
health. So when he builds our home, he wants to make it where it's like we won't get
steel.
like mold toxicity, right?
Yeah,
But
you can use steel and concrete and stone and glass.
yeah, he said that, it's destined to happen either way because you go outside in nature, it's there. Like, how do mushrooms form and all these natural things? But it's the fact that we're using really toxic paint and all these other toxic things in construction that when the mold comes, then it's like that's actually what's breaking down and making it toxic for us to breathe in.
Yeah,
Because why is it we can go outside in nature and it's like we're just fine?
right, right. Well, there's a couple of things. I mean, there's different outdoor molds, and then there's different water damage building molds that can be more
Yeah.
pathogenic or disease causing.
Yeah.
And then outside there's ventilation. It's not like you're
Oh
in this
yeah.
closed space and then with all this mold letting off mycotoxins. And I always tell people, open your windows.
Yeah.
Like if you think it all, open your windows all the time, as much as you can, just air it out, ventilate.
Yeah, there's these like measures for that it tells you when you need to open your windows. And
Oh,
it's hard.
really?
Yeah, and when it gets cold, you don't want your windows open.
I know, you just crack them just a little bit. What kind of thing tells you that you need to open your windows?
I added it to my Amazon cart or something, so I'll send it to you. But it's like it
Oh,
measures the
fun.
CO2 and then it tells you it's like it goes off and you're like, okay, I need to open my window.
Oh, CO2 is what it measures.
Yeah.
Oh, interesting.
But it's still like it's a good reminder because sometimes you just forget all day long, you know?
Yeah. Yeah. And it
So
depends on the time of year and yeah.
yeah, exactly. But yeah, so he was saying, the natural stone and everything like that, people should be building more out of, but and just staying away from those as much toxic paint as you can, but
Yeah.
it is kind of almost impossible to get away from that at some level because of just the weather.
Yeah. Well, and I mean, when we remodel or build, like everything off gases. The,
Hmm.
you'll do a stone thing, but the glue in between, off gases and the vinyl plank flooring off gases and, everything kind of off gases for a while, which again, open your windows and ventilate as much as you can.
Yeah, he
Yeah.
just experimented with this deck on some non-toxic paint for a client, and the next year it's like already looking like he has to paint it again.
Ugh, such a bummer, huh?
Yeah, or stain it. But yeah, so it's like on some level it's like it's just you can't really get away from all the toxins in the world, and I hate saying that as a person who's really holistic, but
I
yeah.
know, it's true. I mean, we come into contact with 700,000 toxic chemicals a day. And like the air we breathe and the water we drink and the food that we eat, it's insane. And I mean, I really think that's part of why more people are getting mold sick is just the total body burden of toxins. So are you familiar with that concept?
Yeah, like we're
Yeah.
just exposed so much that it just weakens us to a point.
Well, it builds up. So it's almost like
Yeah.
you have a bucket and then you get, since you're little, you get exposed to plastics and pesticides and glyphosate, and then maybe some biotoxin from Lyme or co-infections, and then maybe some inflammation from COVID. And then maybe you get in a moldy house and boom, the bucket overflows and, the system crashes when that happens. And so I do think a lot of it is just that total body burden. Like we have less bandwidth because we have so many more toxins built up because we're exposed to so much more. And then another crazy thing is that, and you might know this, but that if you expose mold spores to EMFs from electromagnetic frequencies from, your 5G or whatever, it releases more mycotoxins.
Oh wow. It doesn't
Isn't that
surprise
crazy?
me though.
It doesn't me either, but a lot of people think the EMF thing is, super, weird.
Yeah. But it makes sense. I mean,
It
I
would
can
also make
feel
sense
it.
why it's so much more prevalent or why so much people are so much sicker because now they've got these Wi-Fi's in their house. And so any mold that
Yeah.
was there is now releasing a lot more of their, toxic substances.
Yeah, it's not a good frequency that we should be having, but it's
Right.
convenient.
It's true. It's true.
I mean, like for me personally, just being without the Bluetooth headphones, I get really sensitive to that. So I can only have them in for so long and then
Oh, so yeah, so you can feel
yeah.
it. So I
Oh
don't
yeah.
use Bluetooth headphones. I still have hardwired ones. I won't use them. It just puts the EMS right at your brain.
Yeah, it
It's
does.
like, remember when we first got cell phones and everyone was like, don't hold it up to your head, but
Yeah,
it's kind of
exactly.
doing the same thing.
Uh-huh. Yeah, I'll
Yeah.
have to put it on like speakerphone.
Uh-huh, yeah. Or get the old hardwired ones.
Yeah.
I actually have also a timer on my Wi-Fi. And at night from like midnight or 1 until 6 or 7 a.m., the whole thing just shuts off. And
Oh, cool.
yeah, so the whole family gets to, have a little brain detox overnight.
Yeah, because it is inconvenient to remember like that one last thing to shut off your Wi-Fi. How do you get the timer?
I used to try to do that. And it was always after I was in bed and I would have to get up and go downstairs and you'd finally lay down. I'd be like, forget it.
Yeah.
I got one of those old school little dinky timers on Amazon that you like pull out the times that you want it to go off. And then you just
Oh,
plug the Wi-Fi into that thing. You know, those old school ones?
yeah.
I mean, it was like $6.
Cool.
Yeah, very easy. I mean, you don't need any help installing it or anything. It's funny because people, like so many people have so much like smart homes and things on their Wi-Fi that they're really resistant. They're like, I can't turn it off at night. Like my, camera in front of the door is on. And I'm like, why do you need your ring door camera from midnight to 6? Like you think you're going to see a, It's a
I don't
little
know.
crazy.
I don't know if those lights go off or if they're afraid of being robbed in the middle of the night, I guess, when the
Yeah, I
crazies come out. I don't
guess.
know.
I think people get sort of used to it and
Yeah, they just
dependent
forget
on it.
to unplug it kind of thing.
Yeah.
Um, so to understand the mold toxicity a bit better, what are some common symptoms people could look for?
Yeah, so I mean, there's quite a variety, but there's definitely some patterns. So frequently there's fatigue and brain fog. So cognitive dysfunction of all kinds, memory loss, word recall, focus and concentration, and then commonly headaches and migraines, and then commonly anxiety and insomnia, depression, and then there's a rapid weight gain and weight loss that happens pretty frequently. Like my son,
Mm.
who he put on 30 pounds. He was like this tiny little thing in a couple of months. And in that same mold exposure, I dropped 15 pounds, which I did not need to drop. Um,
Wow.
so that's, kind of one of the telltale signs. And then it usually has weird neurologic symptoms. So you can get numbness, tingling, weakness, burning sensations, ice pick sensations, internal vibration sensations, all kinds of different neurologic symptoms that don't really fit with any neurologic diagnosis that is known yet. So, they go to multiple specialists and rheumatologists and neurologists, and the neurologist kind of goes, well, you don't really fit into any of my categories, so we'll call it something else.
Yeah.
Or they get the diagnosis where autoimmune disorder or something like that. But yeah, so those are common. And then there's some conditions that are associated with mold, like MCAS. Have you ever heard of MCAS?
No, what's that?
Mast cell activation syndrome. So that's it. It's triggered by mold and some other untreated infections, but you get like a whole body dump of histamine after eating, and it doesn't matter so much what you ate. And you get flushing and swelling and hives.
Wow.
Yeah, it's crazy. My MCAS patients can eat like 7 foods, or it's crazy.
They
Anyways,
break into a rash, basically. Like,
they like flush and swell and get hives. And so you have to really calm down the mast cells before you can treat the mold, even though the mold is sort of the underlying root cause. The system is so inflamed from all the histamines. You get like leaky gut and leaky brain, and everything's all sort of swollen. Anyway, so you have to sort of treat the MCAS before you can get at the root cause of mold, because the people who have MCAS, they're sensitive to everything. Like they just won't undergo treatment very successfully.
wow.
Yeah. Yeah. So MCAS we see a lot of, and POTS, hypermobility. And then you see hair loss, frequency of urination, acne, rashes.
Hypermobility, could you explain that a little bit more?
Yeah, sure. So Ehlers-Danlos syndrome, some people might have heard of, and that's like a when all your ligaments are really lax. And that's like a very extreme, like an extreme end of things. And now we're finding there's a spectrum of people with hypermobility, which means that like they're like I have hypermobility, their joints are, lax, and there's a bunch of different qualifications for the diagnosis, but we see way more hypermobility in mold, and in Lyme disease as well. And we don't know, like, are people that are hypermobile more prone to get sick from these things, or are these things contributing to the hypermobility?
Wow.
Yeah, we do
When you
see a
said,
lot of times the hypermobility will decrease after mold treatment.
hmm, when you say that, I would think of like fibromyalgia and arthritis being on the opposite spectrum, where you're just really stiff in all your joints. It's like you can't move, you know? So I'm
Oh,
wondering,
right. Yeah. People
yeah.
with hypermobility, though, they get injured all the time. Their
Yeah.
ligaments don't hold their joints in place.
Oh yeah, it's one extreme to the other. So then the other
Yeah.
spectrum is like for my genes, it's like fibromyalgia or arthritis, right? So it's just really stiff and not mobile.
Yeah. So
So
fibromyalgia is what I call a trash can diagnosis, which,
yeah.
you know, is like, you've got pain all over and we don't know what it's causing it and we don't know how to help you. So we're going to give it a label. We're going to call it fibromyalgia and send you on your way.
Just like
Um,
IBS.
Pardon?
IBS is the same
Just
thing.
like IBS or
Yeah.
chronic fatigue syndrome. You're chronically fatigued and we don't know why, and we can't help you. So we're just going to give it a name.
Yeah.
But yeah, so fibromyalgia is often caused by mold or Lyme co-infections.
I thought so.
Yep. It's actually got a cause, like most things do.
Yeah.
You said you have family history of that?
Yeah, my mom has it directly, and then,
Oh, wow.
of course, I have symptoms, but I don't go to the normal doctors. I'm just like, yeah,
Right,
it's probably this or this or this at this point, you know?
right, right. Have you ever done a mold test?
No, I want to, and a parasite test.
Yeah, you could do both. Did you do stool
Yeah.
studies when you were doing your own gut healing?
No, I just got some in the mail. I need to do it, but it was
Oh,
mostly just
cool.
like me journaling, and then I went on a 30-day juice fast, I went on 7-day water fast. That was a good reset. I think it was too aggressive. But
Uh-huh.
but it definitely helped get things moving. And then after that, I was just like, okay, let's do FODMAPs diet and just refrain from certain things and then reintroduce, you know,
Yep.
and that worked.
That's
So
great.
yeah. But yeah, I still have like a lot of the symptoms you said, like the brain fog, and like it almost like people would just chalk it up, but you're just getting old, you know, like, and then there's
Ooh.
like forgetfulness and stuff and
Right, right.
things like that. I've also thought it was because I bought into the whole birth control thing at a young age, and then that as soon as I got off the birth control, that's when like all my gut symptoms started happening.
Oh,
So it was
interesting.
yeah, it
Huh.
was like it was like I had to face it at that point, because then it was like my hormonal imbalance just went so extreme that um everything just piled on, you know.
Wow.
Yeah, like to be honest, I'll just be real with you. I could not go to the bathroom for 30 days. And I kept calling the doctor. I was like, "Hey, I don't have insurance, so can I and they were like, "No, you have to have insurance." And then finally I just said, "I haven't gone to the bathroom in 30 days."
Oh
And
my
they're like,
gosh.
"Why haven't you come to the doctor?" And I said, "Because you said you wouldn't see me if I didn't have insurance."
That's crazy.
So then I went vegetarian for a while, and like a year, and it was normal, right? Like I pretty
Okay.
much everything got reset. And then after that, COVID happened, and I was so stressed out that I was like, I don't know what it is. Maybe I need to go vegan now. That made it way worse
Oh, wow.
because there's nutritional yeast, so there's mold in there. So you're talking about like a mold test. I like really reacted to the nutritional yeast.
Oh, wow.
Yeah. So then I went to like just more like a homesteading diet. That's what I call it now, where I just try to make as much as I can from scratch, and I just eat like I eat
Oh,
all
clean.
whole bunch of proteins and stuff. I just try to avoid going out to eat. Sometimes I do, but yeah. No sugars, like just the honey, maybe maple syrup, but like no sugar. I try to like stay away from that. Anytime I do, I react.
How do you react to sugar?
Candida overgrowth symptoms, which I'm sure
Like
that might be a
what? Tell
mold
me what, like
symptom.
what?
What?
Like which symptoms?
Like, okay, well, if it's bad, I'll get like this yellow stuff around my lips right here.
Uh-huh.
I can get rid of it with oil, but I'll start to know like my tongue starts getting like white, and it feels
Uh-huh.
very like, and then like I have digestion and like female problems and all sorts of things. And it's like, well, there was too much sugar in that. So
Right. So, where there's mold, there's yeast. So they're both fungal, and mold creates all the right conditions for yeast to flourish. So
yeah,
what I have found over the years, now that I've been treating mold for 12 or 13 years, is that in every mold case, yeast is a part of the puzzle. And sometimes it's a huge part, and sometimes it's just a, little part, and you don't really know till you start getting at it. But you sound like, yes, that yeast would be a part of your puzzle. Anything
yeah.
that you get a direct symptoms from sugar is, I usually think of yeast.
Yeah.
Yeah.
Well, I just don't believe we should be having as much as we should, if any. I don't know what refined sugar was ever for. It's great, tastes
Right.
great. but our
Right,
teeth don't even like it, you know? So,
right.
so
Yeah,
for some people, they're more prone to like just getting cavities. For me, it's just like everything else. It's just like,
yeah,
I think,
that's likely a yeast overgrowth.
yeah, candida
Yeah,
overgrowth, which I don't know, was like mold the spark of that, you know, kind of thing.
it could have been. So if you were in a moldy environment for a while, it just creates all the right conditions for yeast to go crazy. And so most mold patients have a yeast overgrowth that has to sort of be dealt with.
Makes sense.
Yeah.
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 Especially if I grew up in
I
it.
will have to say, before I forget, do you know about magnesium citrate for bowel movements?
I do take like uh magnesium malate and then
Hmm.
the other one at night.
Like threonate or glycinate or
Yeah, and then I spray magnesiums. There's so many different magnesiums out there. That's a whole other world.
yeah, yeah. So magnesium citrate is really good for stool softening.
Mm,
So like 90% of patients with constipation can get themselves moving with just mag citrate. And it's not
yeah.
bad for you at all. You just take as much as you need to have a daily movement.
Yeah.
Because
I
it's a huge detox pathway, right? The bowel
yeah.
movements, having the daily bowel movements. And then so if you're not having them, the toxins just build and build. But so yeah, if just in case you want to try max citrate,
Oh yeah,
instead of
definitely.
1,000 crazy diets.
Oh yeah. I think for me it was like I would try even like a magnesium pill or I would try a laxative or like whatever, like a natural one or whatever herb.
Right,
And
right.
then it was like that would work for a while, but then my body was like, you're not addressing the problem. And then it would just like not, it was like I adapted to it. So then mine was mixed IBS, but I don't really have those problems anymore since
Oh, good.
I like fasted for so long, which if anyone's watching this and hears this part, I would highly recommend doing that with the doctor. I just went for it though. Especially being a female, that can be like really dangerous, you know?
It can, yeah. I mean, what happens is you detox. You detox a lot of fat soluble toxins, and
Yeah.
if you're not supporting the system to detox it well and effectively, then you can, yeah, kind of make yourself more sick.
Yeah. And so I didn't get more sick. It started improving. So then the next thing was just like, all right, I can't have garlic right now. I can't have onions, right? That was a huge thing. So I replaced it with ginger because that was good for my gut. Things like that. And
Yeah,
then just figuring out like, okay, now like if nutritional yeast gets snuck in there, I don't react, but I just know
good.
like I'm not going to have that in my diet. Like I'm not sure if we should even be eating this. Is this even a food? You know?
Right.
So yeah, like that's the concern I have for people who want to go vegan is that that's how they're getting a lot of their vitamin B's and stuff like that. And I thought it was great, so I just pouring it on
Oh,
everything.
no. Probably do reacted a little bit if you have yeast in the system as well.
Yeah,
Mm.
even just a small bit. At one point, like a sprinkle would have made me react, and I was like, "Yep, I know it's this," you know?
Wow, that's crazy.
Yeah,
I think like some people, like when you're older, and especially women, when you're not bleeding every month, like you can maintain a more vegan diet a bit easier.
yeah,
But most, if I see young girls that are vegans, they're all depleted. They're not even making enough estrogen, and they're getting the little fractures, what do they call them? Microfractures and stuff like that. Like they just don't do very well with it.
yeah. I mean, a diet like reliant on supplementation is not good, you know? So I know right now I have a lot of supplements because no matter what, we're going to be lacking something. But when we have animal products, there's a lot less supplements that I need to take,
Mm.
particularly like now it's like I have beef liver every single day as my
Oh, great.
vitamin.
Good for you. So
Yeah.
you're not vegetarian anymore.
No, like now it's like that, like I was saying, the homesteader, like more animal products. I mean, like eggs every
Oh,
single
I missed
morning,
that.
yeah. And even when I
Ah,
was vegetarian, the only thing I cut back was the meat, and that was because I didn't really know how to cook. So I was constantly going to like sandwich shops and stuff like that and like getting my meals that way.
Uh-huh.
And so of course, like the kind of meat I was getting was just like, yeah, you should stay away from that, you know?
Right.
So now it's like, all right, well now I know like get a grass-fed cow, like we bought a quarter cow and just like have like organic chicken and just make sure that it's just like quality meat if you're gonna have it in your diet.
Are
And
you saying that you have them at your house?
yeah,
Good for you.
yeah, we
You're
bought
really
like a,
doing it.
oh yeah.
That's amazing. I didn't pick that up when you said homestead or whatever.
Yeah.
I didn't pick that up.
Oh yeah. Oh, I don't know what you would
That's so
even call
cool.
it. Because a lot of people, they're all about like when they think healthy, it's almost like the greenwash, like, oh, you're vegan then. Like you must be like vegetarian or vegan. If because that's what I went towards because I was like, I don't know what else to cut out in my diet. We'll just like we'll fast from meat then, you know? And it
Right,
works for a
right.
while. But
Yeah.
at some point your body's gonna lack you know, the things you get from eggs, the copper, which then you're going to be lacking iron and you think, oh, I need an iron supplement, but really you need copper. So all those things.
Yeah. Yeah, I
Yeah.
think what you're doing is the healthiest way, like organic grass-fed meats and proteins. And then if you're growing your own vegetables too, it's so dreamy. And
Yeah.
yeah, like I think meat, proteins, and then vegetables and fruit, and that's all the grains and stuff that are inflammatory.
Yeah, exactly. The wrong kind of grains if you are going to have grains.
Right, right.
Oh,
Yeah.
thank you. What about you? What kind of like diet right now are you on? Like, is there, would you even consider yourself a diet?
Yeah, no. I do, I'm gluten-free. I have all the genes for celiac disease. And then I mostly do like anti-inflammatory, just mostly protein and vegetables.
Yeah.
I do quite a bit of intermittent fasting, just to, help your body detox and get some cell turnover, that kind of thing. But
Good.
yeah, mostly
Yeah.
just whole foods, meat and protein.
Good. Yeah.
Sorry,
We
meat
used
and
to
vegetables, not meat and protein.
Oh yeah. I used to do the intermittent fasting in the mornings, but I learned that like if you do it at night, then you can get to bed sooner, wake up sooner kind of thing.
Oh,
Yeah, so it's like you could reverse them. And so I'll like eat a big breakfast, smaller lunch, smaller dinner, and then you intermittent fast the rest of the night.
no, that's
So
cool.
yeah, I
Yeah.
heard like it's better for your metabolism, especially for women,
Yeah,
because
I'm not sure. There's a lot. I mean, there's so many different kinds of fasting and the time restricted eating. And I think we're probably going to find out that it's pretty individualized, like most things, like what works best for, different people. And there is, all the information now on like how to do it with your cycle if you're, a woman and
oh
um
yeah.
yeah.
Yeah, because all the information was for men, we found out.
Right. Like monks fasting.
Yeah.
Yeah.
Uh, so okay, good. It's good to hear you're not on like a diet culture because it's like super toxic too. And I felt like a lot of people when they get into health, they just I can relate is that they yo-yo from one diet to another.
Yeah, I get patients who have like 3 different ones layered in, and I'm like, "You can't do that. You're gonna end up only being able to eat 5 foods, and it's not healthy." Like they'll do FODMAPs and low histamine and, you know, um, anti-inflammatory or one of the other ones, but if you layer that many on top of each other, you're just not left with much food.
No, and then you're not getting any nutrients.
Right. Exactly.
Um, so yeah, how does um the connection with Lyme disease and mold kind of happening. You talked a little bit more about that with your son.
Mhm.
Do you think if we were in an environment that wasn't moldy, like maybe Lyme wouldn't be as prevalent as it is?
Great question. Yeah, I mean, I do think that all the mold is making a lot of people's Lyme reactivate and remain chronic and active in the system. Um, I mean, I guess I would say, I mean, of course, I get like, a very particular part of the population. It's not necessarily representative, but good majority of the Lyme patients that come to me end up having mold, and then they get better with mold treatment and, doing some other detox and gut healing and that kind of thing.
That's amazing.
Yeah.
I just wonder
We could
how
probably even
often,
look at it like, is
yeah,
chronic Lyme so much more prevalent because just toxic load in general and the toxins that we're all exposed to and the total body burden, and the bucket just overflows a lot easier these days. And yeah.
we're the stay inside generation. That's the problem.
True, yeah. And stay inside your moldy house.
Yeah. Because I think it's more common than people realize, especially like being in Nebraska, we have tornadoes, there's basements, and like our basement just got flooded yesterday. I'm like, yep, that's a problem.
Oh, wow.
It's almost like,
But your husband's a contractor, so he knows what to do.
well, I don't know about like the how to deal with the mold. That's a whole other specialty though, you
Well, you gotta
know?
get the water and the damp stuff all out before it has a
Oh,
chance to grow mold.
oh yeah, we did that, I
Yeah, I
think.
figured.
Like, still, it's like the walls though, it's just, so I'm looking at the walls and they're like, and that's so common in
If
the
they're
basement area.
damp, you gotta cut out the drywall at the bottom.
Really?
Really.
Yeah.
Yeah, because I mean, as soon as drywall gets wet and it's gone more than 48 hours, it will grow mold.
Well, yeah, that was like yesterday.
You got another 24 hours. Get your husband on it.
Yeah, I gotta get him on it.
Honey, get your construction gear out. Yeah, if you can dry it or get anything wet out before the 48-hour mark, then you won't get any mold. It's
That's good.
try it.
Yeah.
And then, some contractors now are like, how the drywall meets the floor and there's the baseboard. So a lot of people now are like leaving the drywall not touching the ground and then putting the baseboard over it. And then that way, if there's like water on the floor, it doesn't like get all the drywall wet and go kind of get soaked all the way up. And if especially if you've got like a concrete floor or something, then you can just kind of dry the floor underneath, like pull the baseboard out and dry the water out without it getting in the drywall. Did that make any sense?
Yeah, it does. That would be
Okay.
better than just
But I
leaving.
know, I kind of wish I had done that when I redid my house. Was I
Yeah.
just left a little gap. But I
Well,
have floors, so it probably wouldn't matter. I think it really helps if you have cement or, something not made of
we
cellulose.
have cement halfway and then carpet on the other side, but where it floods is where the cement is,
That's
luckily.
good. Right. Yeah, it is good.
Yeah. Um, so like, do you think mold exposure is commonly misdiagnosed for people, would you say, based off our conversation?
Yeah.
Yeah.
Yes. So, the truth is that like in medical school, we don't get any training on mold, like none at all. And so, when people go to all these specialists and doctors with this, wide variety of crazy symptoms, they look for what they know, and they don't know about mold. Um, and so, they just get misdiagnosed. They get the trash can diagnoses, and they get the rare autoimmune disorder and rare what's the one, connective tissue disorder. I see that one all the time. That's always mold.
What I find is that it's just hard to get a testing from doctors anymore, which I
To
don't
get,
know why.
to get a mold test.
Any kind of testing. I was just like, even when I went in for IBS, it was like trying to fight them for a test and then they just don't want it.
Oh, this is your regular like primary care doc.
Yeah. You have to go to a
Yeah.
specialist and you're lucky if you can get them to write you to go to a specialist with some of the doctors too.
Well, the GI doc wouldn't do a stool study either. Like you'd have to go to
No.
a functional medicine
Yeah,
doc.
pretty much. Which is just like you have to go from one thing to another and it's just like, it's just crazy.
Yeah,
Like,
I mean, well, a good functional medicine doc should be able to, test you for mold and do your stool study and all of that stuff.
hopefully. So then they just like in my experience, when I've gone in there, they're quick to give you a drug, but then they haven't tested you for the drug. And then there's so many misdiagnoses in general for people.
Yep.
That's why it's always been my concern, like whenever I just try to treat my symptoms at home.
Right. Well, it sounds like you've done a good job.
Thanks. Um, so what are the key components of your mold protocol in your course?
Yeah, so I created, I'm super excited about it. I've been treating mold for 12 years or whatever it's been. And my mold eradication protocol is 2 phases. And so I just created a live masterclass for mold treatment for patients. So that, people can sort of get the access to the information and a good mold treatment protocol and not make themselves more sick trying to do it on their own. And I can only legally treat people in Colorado, and my schedule's super full. So I created this course to, be able to bring the information to more people and kind of walk them step by step through a protocol. And so the first phase it's called bind and unwind, and it's binders. So you have to do a good urinary mycotoxin test so that you know which strains of mold are in the body, because different binders work for different strains of mold. So then you choose your binders based on your urinary mycotoxin results. And then in phase 1, it's just a ton of other detox support. So you're supporting organ detoxification, kidney, liver, lymph, and you're making sure the daily bowel movements and getting people sweating. And glutathione is needed to detox and metabolize and pull out mycotoxins. So you've got sort of all that detox support, and you do that for a while. Sort of until your body's doing it really effectively. So you've made your way up to full doses, you feel better or nothing, you definitely don't feel worse. And you've been doing that long enough that your body now is trained how to pull out the mycotoxins. And then you layer in phase 2, which is kill or be killed. And that's where we actually kill or eradicate the mold from the system. So if there is any remaining mold in the system, it's still going to release mycotoxins until you kill it. So like
Wow.
eventually you have to kind of get rid of whatever's still in the body. But that phase is actually really fun because it's when we get a big clinical turnaround. I mean, people usually do so great, and then you get them, they have to be prepped. They have to do the whole other thing first, because if you start somebody on antifungals with a high mold load, when you kill the mold, it releases its mycotoxins. And so they just flood the system with more of the same thing that was making them sick. So you have to sort of train the body to detox for a while, and then you layer it in. And then people tend to, feel most of their symptoms go away if they're not being exposed. And once you layer in phase 2, it can be magical.
Wow, that's awesome. Yes,
Yeah.
you mentioned glutathione. I always heard that's like the thing that most people are missing in their gut.
Um,
What are your
yeah.
thoughts on?
So in their gut, you mean L-glutamine?
Oh, glutamine, yeah. Oh,
Glutamine is
yeah,
small intestinal wall
yeah,
for leaky gut.
yeah,
Yeah.
that's what I meant.
Yeah. Glutathione is an antioxidant. Have you heard of that?
Yeah. Yeah, I take it.
Oh, you
So,
take it. Yeah, yeah, yeah.
yeah,
People get glutamine and glutathione all the time.
yeah, I mixed it in my mind.
Yeah, yeah, yeah. It's like the mother of all antioxidants that you need for good brain health. And, so when you have a big mold exposure, you use up a lot of your antioxidants to pull it out. So your body will use your glutathione and your alpha lipoic acid to try to metabolize the mycotoxins and get them out. And so then they end up tanked. So you end up sort of deficient in these antioxidants, which then affect your mitochondrial function. And so we always do repletion after we treat the mold, where we're, giving the body back all the things that it is now deficient in, so that all your cells in your body and your mitochondria can kind of function optimally again. But low levels of glutathione um, increases your risk of all forms of dementia. And so if you have
Wow.
big mold exposure and your glutathione is tanked from it, like you really want to replete your glutathione. So it's a risk for all cognitive dysfunction as well.
Wow. That's awesome.
Yeah.
Well, that makes sense then, because you're getting the brain fog, so it's treating that and helping your brain start working again, kind of the turnkey of that.
Yeah. It heals neural tissue. It's amazing stuff.
I heard of people saying that it helped with their skin, and you mentioned rashes before.
Oh yeah. Yeah, I could
Yeah.
see.
Yeah. I was thinking like people with leaky gut often they might recommend the glutathione. So I think that's why I mixed up the L-glutamine.
Right, right.
Yeah. Um, okay, so can you share some success stories from the protocol?
Oh, sure. Um, let's see, which one? Do you want a long one or a short one? I have a couple I've got a million, but so I have one patient, her name is Kathy. That's not her real name. And and she came to me when she was 35 years old, and she's a chemical engineer and loved to hike, was doing 14ers all over Colorado all the time and wanted to start a family. And about 2 years before coming to me, she started having these episodic flares. And so, what they would look like is she would get foggy, like really foggy, unable to think. And then she would get dizzy, and then she'd get a headache, and then she'd get exhausted and weak to the point of not being able to like move her limbs or hold her body, like sitting up in space. Like she would fully like slouch and she couldn't verbalize. She would slur her words, and it would
Whoa,
culminate in her falling asleep for 16 hours wherever she was. And her
whoa.
husband found her once on the kitchen floor, and she'd been asleep there all night. These things they were nuts. And they were triggered by too much exertion. So like if she did too much time on a screen, if she did too long of a hike, if it like, and they were getting like what she could do before triggering a flare was just getting less and less and less. And so she, by the time she came to me, I think she was having to go to work part-time and remotely. Um, and anyway, so she saw a whole bunch of specialists and, neurologists. She saw over 14 doctors before me, and neurologists and rheumatologists, and had all the head scans and everything done. And they really couldn't find anything. And so a neurologist called it basilar migraines, which isn't really a thing. And so she came to me and we tested her for mold. Her levels were really high. She had a pretty high environmental toxin load as well. So we kind of discovered at her chemical engineering job, she had a lot of exposure to a lot of environmental toxins too. So that probably was
Wow.
part of the bucket filling.
Yeah.
Um, and then I treated her, and it was awesome because well, it was fascinating, but so when you start phase one and you start binders and all that other detox support, you kind of have to work your way up slowly to full dose. Some you should, because some people are very sensitive. And so she kind of had to work up slowly in phase one to full doses of binders, or else it would trigger a flare.
Wow.
Yeah, because
Well,
she was
that's
detoxing
crazy.
more.
Yeah. Well, and so kind of go the route I went, which is like an experiment. For most people, that could be really dangerous for someone like her, especially if she just went like, I'm gonna go and target parasites, let's say,
Yeah, like if she
And
just went out and bought a cholestyramine and started on 4 packets a day.
yeah, just something, and then it triggers to your symptoms being even worse because you don't know the root cause, you're not testing, you're not,
Or
yeah,
you're just pulling out more than you're trying to pull out more than the body can actually detox.
yeah. And then
Yeah.
it probably make her symptoms like in where she's out in the bed. And I've had moments like that where it's just like, I don't know what I did, but today I'm just in bed out cold,
Oh
Because
yeah,
I just did the
yeah.
wrong thing.
Well,
Yeah.
yes, it took her a couple of months to get up to full dose. And then but when she was like in phase one, she started having like more capacity. So she could do maybe 3 hours of screen time before a flare. Like some things got better, and she got off all the medications that the other specialists had put her on. And then we started phase 2, and the same kind of thing happened. Like she had to work up slowly on her antifungals or it would trigger. But then once she got up, about 6 months later, they were completely gone. And she'd lost 25 pounds and she's starting a family and hiking up to
Wow.
Colorado again. Yeah, she did.
Wow.
Yeah, she's a real interesting story. Isn't that crazy what would happen to her?
Yeah. Well, it's crazy, like how you can bounce from this to that, and she did it without being on drugs, for the rest of her life. Just trying
Right,
to
all the
treat
medications that
symptoms.
weren't helping.
Yeah. Do you want to share any other success stories or?
Sure, I'm happy to. So I'm trying to think what would be a good example of something different. So, another patient I had came to me when he was 46 years old, and he had neuropathies all over his body. And what that means is like numbness, tingling, weakness, burning sensations, ice pick sensations, vibrations, and they would move around the body. So we call that migrating neuropathies. And then he developed like really intense anxiety and depression and insomnia and ruminations and OCD. And he never had any of those things before. Um, and then, and then when he got a little bit better and he would get exposed to mold, he would have the sensation of water running down the backs of his legs. So like once he got better and if he walked into a moldy movie theater or something, like he would get the sensation of water going down both the backs of his legs. Not
Whoa.
nuts. So,
Body
so
warning
he,
him, like
what?
that's like his body warning him intuitively.
Exactly. It's your own alarm bell, so you don't get poisoned. Um,
Wow.
so, um, so he did think it was mold because he had been living in a moldy place. And so he did that like Dr. Google and looked up what to do and found cholestyramine, which I don't know if you know what that is. It's a strong binder for mold. It's a prescription one. But it only gets one class of mycotoxins. In any case, went from, 0 to taking 4 full packets a day, like every day. And then he made himself so sick because he released so many more toxins into the system that he was utterly bedridden, debilitated, and suicidal by the time he came to me.
Wow.
Yeah, it was, I mean, so when I start somebody on cholestyramine, I have them do a quarter of a packet for like 3 or 4 days before they go up to half a packet. Like you have to kind of work up slowly. Anyway, so he made himself way more sick. And then when he came to me, we tested him and then we knew, exactly what mycotoxins he had in the system and what we needed to bind. And he did really great in phase 1 and things got, gradually better week after week. And then when we started him on phase 2, probably 3 or 4 months, and his neuropathies went away and his neuropsych stuff did too. So the anxiety and depression and OCD. And I mean, he was just so shocked at how, a physical thing like that can create such emotional symptoms. And he told me in the very beginning, he was like, it doesn't feel like me. Like I never had any of these symptoms. It feels like I've been like taken over by something. And then, when we treated him and it went away, he was like, that is insane that it
Wow.
could do that to you.
I didn't know ruminations would be part of like a toxicity thing or mold
Can be.
toxicity.
Yeah. Are
Wow.
you familiar with any of the co-infections in Lyme, like Bartonella?
Uh-uh.
Yeah, so Bartonella is a co-infection of Lyme, similar symptoms to mold. They tend to sound a lot alike. But yeah, you'll get ruminations and OCD and stuff with Bartonella as well.
Wow. Crazy.
Amazing. I know
Well, I
it's
mean,
wild world.
you think we're in a mental health epidemic or crisis, and maybe it's our moldy homes that
Right.
we're living in, our moldy schools
Exactly.
or whatever
Yes.
buildings.
Yes. And then, everybody stayed home for 2 years. And so if your house was sick, maybe you could tolerate just an exposure part of the time when you were going to work and then you're at home 24/7. So a lot of people had that story. Like after the pandemic, they were sick from mold.
Wow. That's crazy. I wouldn't even think. I mean, because I hear it and I'm just like, oh, there's mold everywhere, you know?
And there is, and it's normal mold everywhere, the outdoor molds. It's the water damage building molds that are pathogenic or disease causing.
Yeah. Well, even like in the buildings, it's like, how do you avoid this stuff? It's almost like the toxicity overload, like you were talking about. It's like the heavy metals and can't live in a bubble, but at the same time, it's like you just have to cultivate an environment in your own body where you can be more resistant to everything going on, you know?
Exactly. So you're talking about like lowering total body burden. So then you've
Yeah.
got more bandwidth to which the body can interact with the world and all the different exposures.
Yeah, pretty
Yeah.
much.
Daily detox.
I was gonna ask you about zeolite because you were mentioning binders. I hear a lot about that, and when I took it, I felt like a significant improvement with my gut overall.
Oh, cool.
Yeah.
So zeolite is more for metals than for mold. We don't really use it in mold. It's a good
Oh,
binder for heavy metals though.
yeah. Heavy metals and parasites, what I heard, but that's why I took it. So, did I see any parasites? No, but I mean, I had a great improvement with my health. So,
Awesome. That's
yeah.
great. They bound something that your body didn't like.
Probably, yeah. So what kind of binders, because you said the binder protocol, could you name a few on like
Yeah.
that you
So
recommend?
activated charcoal is, common. We use that for trichothecenes. Those are the mycotoxins that come from black mold or stachybotrys. They're really intense nerve toxins. Um, so activated charcoal is the best binder for those. And then there's bentonite clay, which is a good binder for gliotoxin. I'm not going to answer that. And then cholestyramine is for like ochratoxin A. And then, there's other binders that you can add to it, like chlorella or, I mean, sometimes there's zeolite and some of the combo ones. Sometimes there's silica, there's a few other things. Those are kind of the most common ones though.
uh, I did something like that.
You said
I did,
charcoal and clay?
yeah, and the charcoal, and there was also, I think, diatomaceous earth.
Mm-hmm.
I don't know if you ever use that too.
I don't, because it doesn't really pull out mold.
Yeah. Is it more just the heavy metals for it, or I
To
don't
be
know?
honest, it's a patient favorite, but not like I never never hear it
Yeah.
about it at conferences and stuff. So I'm not exactly sure what it pulls out, diatomaceous earth.
It was in a protocol I had. So
Yeah, it might be environmental toxins like plastics and pesticides and stuff.
could be. Yeah. Um, so a little bit more details on your course. Um, are there any prerequisites people need to have to enroll, or like do they need to be like in line with a doctor? I mean, you're already the doctor, but like do they need to be working with a doctor in their local area in order to be using the course?
Yeah, so you need to have hope. You need to believe you can get better. You can't believe that you're never going to get better, because then you won't. And then the third thing is, yes, you need a supportive physician for just a couple of scripts. And so I have a whole comprehensive find your supportive physician guide with thousands of physicians on it. And my partner at my office is a nurse practitioner, so she can treat people in all different states. So if anybody had a hard time finding one, they could use her too. And it's just for a couple prescriptions. So like, it's a doctor that believes that mold exists, but doesn't know how to treat it. And it's probably, I don't know why my phone is doing that lately. It's been saying out loud, you have a voicemail and my volume is off.
Oh no.
It's just bizarre. It's just started doing that in the last 24 hours. What was I saying?
Basically you're just saying that, there's a few
Supportive
scripts.
physician. Yeah.
Yeah,
So it's
yeah.
probably not your primary care doc unless they're more holistically oriented. But the docs on the list are all like holistic, integrative, functional, or biotoxin, Lyme, and mold.
Cool. Awesome. Okay, so as an individual to prevent mold growth, like we talked about, if there's a leak, you talked about cutting it out kind of thing earlier. What are some things you could do to prevent mold in your home?
To prevent, yeah. So, there's a few things. So I have on my main water line, like it's called a smart flow meter. And so if there's ever any like unusual output of water, the whole main water line shuts down. So like, and I get notified a bunch on my phone before it does. But so like if you were to have a pipe burst and you're out of town or at work or something and you don't know, then the whole thing would just shut off the water. So I think that makes me feel better somehow. And then, so, HVACs are sort of notorious for having, spreading mycotoxins and mold spores throughout the house, but also being kind of a reservoir because there tend to be kind of dusty and dirty and mold spores likes that. So
Mm,
getting your ducts cleaned in your house every couple years, I recommend, and then getting it, if you get a good, even, an indoor environmental professional just to do an evaluation, they can often find things that could end up leading to water damage. So your husband can do this, but they'll look in the attic and they'll look on the roof and they'll look at the gradient and slope toward your house. They'll look in the crawl spaces and, if they see things that could become an issue, they'll tell you. So that's kind of helpful. And for, not for you because you've got your husband, but for other people out there, if you've worked with an indoor environmental professional or an IEP, then when something like what happens to you last night, then you already know them and you can go, okay, it just flooded. Can you come or can you tell me what to do? And then,
yeah.
what I mean, you kind of have that in your back pocket. Um, and then let's see, I mean, cleaning it's weird, but yeah, mold will settle in dust, and dirt. So, that's helpful. Um, so mold can also form in the P traps of your sink drains. So your sink drains and there's this little thing, and if it gets dried out, and there's some like dirt and whatever in there, and it gets dried out, it'll start forming mold. Mold will grow on it. So another thing is like if there's sinks in your house that don't get used that often, is you kind of just want to run like a gallon or two of water down them every couple weeks just to flush out that P trap. And then
Mm,
sometimes people do hydrogen peroxide afterwards.
that's good to know.
Yeah. And then, ventilation is a huge one. Just, ventilate as much as you can. And then, what are some of the other ones that I have? You can get these little moisture meters that you put like under your sinks in case there's a little slow drip that would go beep beep and let you know. You can get that kind of thing too on Amazon. Um, I feel like I'm forgetting like 20 other things. Oh, there's a great whole house. It's not a filter or purifier, it's an ionizer, and it's called the iWave. And you put it on your HVAC system, it gets installed onto it. And basically, it's got negative and positive ions and a magnet. And it takes the particulate in the air and kind of makes it sticky. And so it falls to the ground. And so, what it's doing is just getting mycotoxins and mold out of the air space that you're breathing. And then you just need to like wipe the floors, clean the floors a little more often because it just gets them on the ground. But
Mm.
I love my iWave and, I often will tell people to get that if they're in a moldy place and they can't get out quickly, because they'll feel a lot better with one of those.
What's it called again?
The iWave
iWave. You can get it off Amazon?
little thing, I don't know. I have a bunch of remediation companies and stuff that I work with here regularly with patients, and one of them installed it for me.
That's cool. I did
Yeah.
not know all that.
Yeah. And then, oh, if you do have an HVAC, you want to have a MERV 13 or higher filter on it, and you want to change your filters every 3 months.
Oh,
Yeah, so there's a rating for those HVAC filters, and 13 is like, you know, it catches smaller things, so it can catch mold spores and keep them out of your breathing space. And then you just want to change them pretty frequently. And you can go even more, like you can get a MERV 14 or 15, which you know will trap even more smaller particles and mycotoxins and things. But sometimes then your heater and air conditioner don't work as well because they're trying to push through this really finely woven filter. And so yeah, so just be careful of going too crazy on it. But a MERV 13 works for most.
MERV 13.
Yeah.
Okay. And change it every few months. Yeah, that makes sense. I think a lot of people, they'll forget to change the filters in their home, and so you can smell it, which I don't know if that's the mold you're smelling, which is concerning. Yeah, probably.
Probably. Who
Especially
knows?
older
But,
homes.
right.
Yeah, always has that old home smell.
Who knows? That could be a variety of things, right?
Yeah, it's true. Which I like older homes. It's just, there's things you got to keep up with,
Yeah,
safe.
100%.
Yeah. Okay, so as we conclude, what are some key takeaways that you'd want our listeners to know about your course and about just overall what we talked about?
So I mean, this is probably hard for people to hear, but they're probably not going to get better if they stay in a moldy place. And if they are mold sick, I mean, you generally need to try to get out. And there's ways to test, new places with a rapid turnaround with, what an ERMI is?
Uh-uh.
Like qPCR. It's like a dust test for mycotoxins. And so you just do, it's like a little Swiffer and you take dust samples from the tops of frames or, places that you could collect some dust. And then you send it in, and there's a company called EnviroBiomics that does one that has a 24-hour or a 48-hour turnaround. You pay more for. But if you're getting out of one moldy space and you want to make sure you don't move into another one, that's a good way to do it because you can find out really quickly. And then, the other things I guess I would want to say is just don't try to do too much too fast. Like people people think that if they do, they'll just get through it quicker. But it just doesn't really work that way for mold. So like suffering through, doing too many binders for your body's ability to detox, like it just doesn't get you there any faster to suffer. You have to sort of honor your body's ability and what it can do in each, phase to detox. Um, and the other big one is, you really do have to do like all the detoxification stuff for a while before you try any like antifungal or biofilm busters. Because if you do those too early, you'll just flood the system and make yourself more sick. Um, yeah, and I can tell you a little bit more about the course. So, it's going to be a live masterclass. It'll be every Monday starting this summer. June 17th at 5 o'clock will be the first one. And it'll be every Monday after that. So it'll be a live course with me and then Q&A afterwards. And when people register, they'll get like the first 9 modules of the course to do on their own time. And then that gets you right up to the testing part so that it takes about 3 weeks to get your test results. And so that by the time you get your test results in hand, we'll be ready to start phase 1 mold detox bind and unwind in June.
Wow. Awesome. Okay. And then how can listeners get more information about the webinar course upcoming?
Yeah. What's the best way for me to like put links or something?
Depends on where we're posting, so I'll probably edit that part out. So,
Okay. Okay. Yeah. Do you want me to say just what the website is?
yeah, maybe something about that.
Like the webinar page, maybe?
Yeah.
Let me see. Okay, so there's 2 websites and we'll have them, written as well, but it's they're long. Oh no, it's moldmasterclass dot drfoxmedicaldetective.com /webinar dash dashboard. Oh, I think you should probably just edit that all out too.
Yeah, probably. I mean, I might say this, so if you're listening on YouTube, it'll be linked down below. If it's on the
Yeah,
podcast, it'll be in the show notes. And then if it's on TikTok or Instagram, it's linked in my bio. So
awesome. Thanks.
check out one of those places. Well, it
All
was
right,
good
great.
having you. Thank you for interviewing today and talking
Oh,
more
you're
about it.
welcome. Lovely to meet you, and thanks for having me.
Yeah, it was a very enlightening conversation.
Oh, good. Oh, great. I hope that your audience likes it too.
I hope so too. Thank you so much.
Oh, you're welcome. Take care, Liberty.
You too. Bye.
All right. Bye.